The term white lung syndrome has emerged due to a concerning outbreak of a novel bacterial pneumonia strain that has affected numerous countries globally such as China, the US, specifically Ohio, and parts of Europe, where cases have been reported and sparked concerns. The outbreak is notably affecting children between the ages of 3 and 8. White lung syndrome is characterized by the presence of distinctive white patches on chest X-rays or imaging scans of the lungs. These white patches are indicative of abnormalities within the lungs and are associated with various lung diseases including bacterial and viral infections such as pneumonia and influenza. So the term white lung syndrome is not a disease, it's rather a manifestation of numerous lung diseases. These white patches, also known as pulmonary infiltrates or lung consolidation, these white patches form when you have an infection in your lung. This infection causes your body to send white blood cells to fight it. Dead cells and debris build up creating pus, which fills the small airways which later appears as white patches on chest X-ray. Causes. There are still ongoing investigations about the suspected causes of the disease involving a complex interplay of bacterial, viral, and environmental factors. Mycoplasma pneumoniae is the most suspicious one for the cause of this disease. This bacterium is known for causing respiratory infections, and it's suspected to play a role in the development of white lung syndrome. Mycoplasma pneumoniae infections can damage the air sacs in the lungs, leading to inflammation and potentially contributing to the formation of white patches seen on chest X-rays. Viral infections, especially influenza or respiratory viruses like COVID-19, are believed to be potential contributors to white lung syndrome. These viruses can damage the delicate lung tissues, including the air sacs, creating conditions conducive to the appearance of white patches on imaging studies. Environmental factors. Inhaling silica dust, commonly found in certain occupational settings such as mining or construction, is another environmental factor associated with white lung syndrome. Silica dust can irritate the lungs, making them more susceptible to infections and potentially contributing to the observed respiratory conditions. Symptoms. White lung syndrome encompasses various respiratory conditions, each presenting with its unique symptoms. However, some common signs may be observed across these conditions are shortness of breath. This can range from mild discomfort to severe respiratory distress, depending on the underlying cause. Coughing, persistent or chronic coughing is a prevalent symptom. The cough may be dry or accompanied by the production of phlegm, and its intensity can vary based on the specific respiratory condition involved. Chest pain or discomfort is a common manifestation. The pain may be sharp, dull, or aching, and its location and intensity can vary based on the specific condition causing white lung syndrome. Fever. Many individuals with white lung syndrome may experience fever, especially if the underlying cause is infectious. Fever is the body's natural response to an infection or inflammation. Fatigue or general weakness is a frequent symptom. Respiratory conditions affecting the lungs can lead to decreased oxygen exchange, contributing to feelings of tiredness and lethargy. Management. The severity of white lung syndrome can vary significantly among individuals. Treatment is based on the specific characteristics and severity of the condition. So in cases where bacterial infections, such as Mycoplasma pneumoniae, antibiotics may be prescribed to target the specific bacteria causing the infection. For respiratory conditions with a viral origin, antiviral medications may be considered. These drugs aim to inhibit the replication of viruses like influenza or other respiratory viruses. Individuals experiencing respiratory distress may benefit from oxygen therapy. Supplemental oxygen helps maintain adequate oxygen levels in the blood, alleviating symptoms of shortness of breath. In severe cases, mechanical ventilation may be necessary. This involves the use of a ventilator to assist with breathing when the lungs are unable to function effectively on their own. Corticosteroids may be prescribed to reduce inflammation in the lungs. This can be particularly relevant in conditions where inflammation contributes to symptoms. Supportive measures such as pain management, hydration, and adequate rest are essential components of treatment to address overall well-being and aid in recovery. If you found this video helpful, don't forget to hit the like button and share it with others who may need this information. And lastly, subscribe to the channel so you'll never miss out on any of the helpful videos we upload. Thanks for watching. See you in the next video. Stay healthy and stay happy.